Chronic obstructive pulmonary disease, or COPD, is a group of diseases that affect the lungs, causing difficulty in breathing. It affects millions of people worldwide and is the fourth leading cause of death in the world, following heart disease, pneumonia, and HIV/AIDS. According to the WHO, the worldwide prevalence of COPD in 2002 was 11.6 cases per 1,000 men and 8.77 cases per 1,000 women. In 2004, there were 2.75 million deaths due to COPD worldwide, of which 1.41 million were men and 1.34 million were women. COPD is a group of diseases that affects the lungs and the airways, worsening progressively and limiting the ability to breathe. It includes conditions like chronic obstructive bronchitis and emphysema. Respiration is a process by which oxygen is taken in and carbon dioxide is expelled from the body. This function is performed by the respiratory system.
A study in the Annals of Internal Medicine reports that older people with COPD may live longer using long-acting beta agonists than anticholinergics. The authors compared the two types of agents in more than 45,000 COPD patients 66 and older. 28,000 used a long-acting anticholinergic and 17,000 a long-acting beta agonist. Canadian health administrative databases provided information about health services, prescriptions, and mortality, but not lung function. Over a 5.5-year period, about 40% of those given anticholinergics died. This compared to about 37% of those on long-acting beta agonists, for an adjusted hazard ratio of 1.14. And the authors found that the incremental risk associated with long-acting anticholinergics seemed to be independent of patient sex, coexisting medical conditions, or whether the diagnosis of COPD was confirmed with spirometry. They acknowledged that they could not account for potential confounding by indication or disease severity and called for confirmatory randomized trials. Nevertheless, the authors suggested that long-acting beta agonists may be more effective than long-acting anticholinergics at improving survival in older patients with COPD. This is Dr. William Fredette for Reuters Health, the Doctor's Channel Daily Newscast.